I'm Emily, Director of TLC Wellness. I am joined here today by Dr. Saviano and Dr. Buckwalter. So really my goal will just be for myself, or my role, I should say, is just kind of guiding and providing some questions and looking at letting people in the room and looking at the questions. But Dr. Saviano and Dr. Buckwalter are the holders of information here. So I'll let you both introduce yourselves.
I'm Dr. Buckwalter. Hi, good morning. I have been working in the mental health field for about 30 years, working in different capacities. At this point, really doing a lot of work with younger children, some teenagers as well, but mostly I would say very little children up to middle school age children. Working with a variety of different illnesses, different levels of services, a lot with people might be familiar with wraparound services, family-based services. And in that scope, I definitely see a number of children with autism, ADHD, as well as a lot of other diagnoses.
Hi, I'm Dr. Saviano. Most people just call me Dr. Sav. I graduated from Philadelphia College of Osteopathic Medicine with my doctorate in school psychology. So I am a school psychologist, Pennsylvania and national certification. I'm a board certified behavior analyst, a licensed behavior specialist. And yeah, I've worked in lots of different types of communities. I've worked with underserved populations. I've worked in more affluent areas. I trained at CHOP in neuropsych and at the Center for Autism Research. So I really have had an emphasis on children and development throughout my career, but I'm now starting to do some work with adults as well.
Great. So we'll hop right in. So we'll be talking around the topics of assessment and steps for autism, ADHD, and learning disabilities, but then could also flow with whatever comes up within the context of that. So, and again, please, if there are specific questions that you're looking for, don't hesitate to put them into the chat. So I'll start, I guess I would call this the beginning. I think it can be really confusing for caregivers to know when to seek an assessment, what are things they should be looking for. I think especially, and I'm a parent of 3 myself, you see so much on social media. I call it the age of like the social media parent, right? Not everyone's on that, but many people are seeing some level of like things, from it's like information overload. So how would a caregiver or even say like a counselor of a school, if they're seeing things to recommend a caregiver get an evaluation, like what would you recommend are kind of like the flags?
As far as just in any scope, any type of diagnosis?
Let's start with autism.
Okay. So the thing I would say right at the very beginning, my experience has taught me that moms really need to trust their intuition. A lot of times, I've heard so many times over the years, moms tell me, I just always felt like something wasn't right. This wasn't feeling right. That wasn't feeling right. And a lot of other people will kind of poo-poo them, other adults in their lives, sometimes even the pediatricians, and parents will say, but I always knew, I felt it. So I would really say to trust that. As far as specific symptoms to look for when you're talking about your children, really as young as like a year to 2 years of age, some of the earliest signs will be kiddos not making eye contact with you. So maybe you try and call their name and they don't respond, they don't turn their head in your direction. A lot of times parents will tell me, well, we check their hearing. That'll be a very first step of what parents will be told to do when they go to their pediatrician. Let's make sure they're hearing everything. And the hearing tests undoubtedly or typically come back, everything is fine. So if they're not orienting to you when you call their name, if they're not engaging in what we call shared attention, so if they're not bringing toys to you, if they're not coming to want to be by your side, if you're holding a toy out and they're not coming to you to play with that toy together, if they're having temper tantrums that seem very excessive, oftentimes we'll hear parents talk about kids banging their heads. Maybe they'll bang their heads to fall asleep, bang their heads as a mechanism for soothing themselves. Just looking at my list to kind of highlight some of the other things. Sometimes kids will just kind of sit there idly, not really doing much. And this is when we're talking about a little bit of an older child. So obviously not a few-month-old child, but when you're looking at someone over the year age mark, they're not really playing with toys and just kind of sitting there, sort of listless looking, not really any interest in the environment. Sometimes kids are hypo or hyper responsive to stimuli in the environment. So maybe there'll be a fire truck that goes by, or you run the vacuum cleaner, or you run the blender, and your child begins to have a temper tantrum or maybe covers their ears. Conversely, fireworks, that'll be another one that families will tell me about, although I would caution because I think that typically can upset a number of children, autism
I
or
was gonna
no
say the
autism.
noises are so hard, like the blow dryers, like it's just such a, yeah.
Mhm.
I feel
And
like
that's
those are
a
the ones that can be confusing.
yeah, that's definitely a point I want to get to later. So I think I'm going to hold on to that. But so, and also, or conversely, they can be under responsive to noises. So maybe there is a lot of noise and they don't seem to pay attention to it at all. And you're thinking, huh, that's kind of unusual. They could be sensitive to the feel of clothing. Maybe you're dressing them in the morning and they're having a temper tantrum. Um, Dr. Sav, I could go on and on. I could probably take 45 minutes just on that question. I don't want to dominate, so I'm going to turn it to you for a minute.
No, I know that was very well said. And, everything that I would want to look out for too. I think another big thing is regressions. So if your child, started, developing skills and then suddenly they lose those skills, right? And you're not sure quite what's going on. And behaviorally, we want to look at things like repetitive behaviors, unusual interests, right? I had a kiddo with autism who just loved elevators, and that was just like his jam. We would watch videos of elevators. But some of that sort of unusual behavior, Dr. Buckwalter highlighted the resistance to change, right? Those difficulties with transitions. And another one for our younger kids too is limited imitation skills, right? So being able to imitate what a caregiver is doing. And then there's also, some of the sensory sensitivities that were just mentioned.
I
So
would say with the repetitive, oh, I'm sorry. I was going to say, along with those repetitive behaviors, a lot of times kids will watch the same video over and over again, or want to watch the same television program over and over again, almost like it's on a loop for them.
Mhm.
So if a parent was noticing some of these things, what would they do? Like, I think, what we really want to do is make this talk very friendly to just like
Mhm.
people who are either maybe in the behavioral health field and not assessing, want to know where to send kids or what to do next. And then also people who may have nothing to do with the behavioral health field. And then do have another question after that, but I'll let you answer, that first.
I think that one thing that's really helpful for me from parents when I do an evaluation is having examples, right? So things that you're seeing, concerns that you have, just starting to write that stuff down, almost like a brain dump, right? That really helps me kind of put all of the pieces together. And then seeking a consult for an evaluation. I'm available to do consults before evaluations just to see if we're a good match, what your concerns are, and just starting to take those first few steps to get the process started.
Mm-hmm.
And I would say, from a global perspective, if you have concerns, you can contact early intervention. They work with children from birth until 3. After the age of 3, you would contact your local intermediate unit. They work with children from 3 until they enter into kindergarten. Uh, Talking with the pediatrician can be very valuable. I just, again, I want to emphasize to trust your instincts, because I think, and I in no way want to disparage pediatricians, but I think sometimes because they have such a broad scope of emphasis, that they might sometimes miss some of the smaller nuances of autism.
Well, I can speak to that as well, like being a clinician, and I actually worked in pediatric primary care. it can be easy to normalize things sometimes. So I think
Hmm.
that's kind of where you're coming from too. You see things
Yeah.
so frequently, and then I could be I recognize within myself and really challenge myself as a clinician because I have three little ones at home too who are like someone's always having a tantrum or fighting about something or whatever it is. And so I think when you see things so frequently, you're like, oh, that normal, that happens. And I find that whether or not it is typical, it still can be really frustrating to a parent who's in it for it to then be like kind of like downplayed in that way. So it's no intention. So I think we find ourselves in that a good bit. So I think I'm hearing kind of that's what you were saying, Dr. Buckwalter, when it comes to that scope or setting. Um,
And I wonder if this is a good time to bring the point up I wanted to bring up before. I knew we were going to get to that naturally later. This idea of how do we know when something is normal? How do we know if something becomes more problematic? And I think there are a couple pieces to take into mind. So, first off, yeah, most children do have temper tantrums. So, where it becomes a problem when it's happening with the frequency, intensity, and duration that it's really impacting your everyday life. So, if the child is having problems consistently at school, having problems consistently at home, consistently out in the community, where it's impacting the flow of your family's normal everyday functioning, then that makes us a little more concerned. Maybe there's something going on beyond just typical development. And I
mhm,
think this kind of gets to the assessment point of things that you really want to take into account a holistic picture. So you want to look at everything going on. So, what else is going on beside those temper tantrums? So, as opposed to just taking one particular behavior, looking at a whole broad outline.
mhm,
Yeah, I think that piece, that functional impairment piece, right, is so important. If something is becoming, such a big problem that it's interfering with like daily tasks, then, we really want to get to, which we'll probably get to this later, but the point of an evaluation is like really to get to the root of the problem. You
Hmm.
might have a couple pieces, maybe the school figured out a couple pieces, and then our job is to really come in and put the whole picture together like a detective, right? So yeah, I think that was well said, Dr. Buckwalter.
mhm. And actually on that point, because I feel like it could even sound in language like a lot of what we're referring to are younger children. But what about for caregivers who feel like it's too late, or do they come late to the game if their child is older, maybe adolescent or even teenager, or even like soon to graduate, and parents like, oh no, they're going off to college, and are they ready? And we still feel like there might be something going on. Can you speak to that a little bit?
I will say it's never too late, right? If something is going on, we want to know what it is. And sometimes what can happen is that symptoms will be masked, right? So kids learn how to sort of get around the things that they're struggling with. For older students or kids that have been like high achieving, they may have developed some compensatory strategies along the way. But then sometimes that starts to break down with the transition to adulthood or the transition to college, and things don't start to, we don't see that functional impairment until later on, but there's still things that we can do. And when we do evaluations, I think the biggest piece of them for me is the individualized interventions and really figuring out, okay, how does this individual's brain work? And how can I use that information to design what's going to work for them at this stage in their life, whether they're 3 years old or 30 years old.
Mm, okay. I like that. Super helpful. And I think it's an important reminder to people because oftentimes when I have worked with, whether it's adults or even teens or college students, it's kind of like, well, I've gotten this far. So what will finding that out do for me if I've made it this far? Or if an adult finds similar attributes that they see in their kids to them, if they're like, well, I got through, so they'll get through too. Like, what's the risk of not getting evaluated if there's kind of maybe that mentality or uncertainty?
Well, I would back up to the benefit of getting evaluated first. So, we all have patterns of behavior in our life and we accommodate and acclimate to them. And then maybe you do something different one day and you think to yourself, holy moly, that was so much easier. Why wasn't I doing it like that all along? So that's the benefit. If you can make your life easier, and why not? And
Yeah.
when you get stuck in those patterns, you don't even realize that you're in that pattern and don't realize things could be easier. So why not do that?
Yeah.
And
So we
almost
have
like, oh, sorry.
no, that's on. Go on. You can go on. And then we did have a question that came in that actually segues into some of our next questions. So it's perfect.
Oh, okay. Well, I was just gonna say, like, think about it if you found out that you had, some type of like medical issue or like some type of physiological thing going on, like you're sick, and you find out you're sick, and you think, well, I've made it, most of my life feeling, kind of crappy and sick. I'm sure I can keep going. But if there's an opportunity for an intervention, right, a medication or something that could help that to treat those symptoms, we want to know that and we want to be able to implement those things.
Um, Perfect. Thank you both. And so we were also talking not just about autism, but also ADHD, learning disabilities, some overlapping. And so this question I think is in perfect timing. And essentially the gist of it is that their child has some overlapping symptoms. So, right, there's some trauma history, some anxiety, OCD, and ADHD. All of the care providers have recommended ASD eval, but it's hard to tell with so many overlapping symptoms. And I think, especially highlighting that trauma history, that can be hard too to tell between like what's what, parceling out. Um, it's also hard to know how to find someone to do it who will understand everything else that makes up that person. And I think this is so important because people are not two-dimensional, right? So um, start wherever you think would be most helpful with that.
I think the developmental history piece is so important. Right? Because often, kids with autism will show signs early on, sometimes as early as two, some delayed or atypical development, some of those early signs that Dr. Buckwalter already went over. So having that developmental history is really,
Dr.
really
Buckwater, if you
important.
can just mute while they're
Yeah, just to see when everything started. And also having a competent clinician that's willing to consult across settings, right? So to talk to the doctor, to talk to the school, to talk to any other outside providers to get a really holistic understanding of what's going on and sort of trying to parcel out the etiology or like where certain symptoms are coming from.
Yeah, I think that's perfect. I didn't know if Dr. Buckwater had something to add to that, but I think she did let me know coming on that her dogs were in the background. So I wasn't surprised when I heard them. Oh, there she is. So I think that that is super helpful. And I'm not like saying this just as like because we're on here. Obviously, we're not like the fit for every single person in the world, but I definitely think we could help with this. So, to the person that posted it, I'm more than happy to talk to you. I know Dr. Saviano is she does kind of the additional ADHD and additional testing as well. So I certainly think this is something we could chat about. So please don't hesitate to reach out. We'll talk about all of our contacts. And at the end of the day, if someone can't stay till the end, you can always find our contact on our website, wellwithtlc.com. But something that I find huge with TLC wellness in general, evals or not, is that the behavioral health problem can be so confusing and challenging to navigate. We're always happy to answer questions, even if it's us saying, hey, we can set this up, or hey, here's where you can go for that. So
I think too, just really quick, Emily, something that
yeah,
really offer at TLC is an individualized approach and an individualized battery, right?
yeah,
So if you have concerns about multiple things, really, it's not just every evaluation consists of the exact same, instruments or assessments. We really want to get to know your kid. And we do that with a highly individualized approach.
yeah, yeah. Totally. So then as far as like getting into the ADHD and learning disability of it all. And of course, this is a short time to cover. So I'm just giving the preface that we can only cover so much and we also don't want to over inundate with information. So we're trying to give the broad strokes to help just with general access tools and information. But as far as ADHD goes, is there anything that you would say about assessment for ADHD? I think that's more specifically Dr. Saviano's, you're doing those. Anything that direction you would take that, do you think would be
Yes.
helpful?
So for ADHD, we want to look at a couple things. Definitely want to do an observation in the naturalistic environment, which I do for all of my evaluations anyway. But we really want to see again that degree of functional impairment or what's actually happening. If across settings is possible, that's also great too to get that information. But we'll do rating scales, so standardized rating scales like questionnaires that you would fill out, which compare, your child's functioning to, other kids that same age with or without ADHD to see if there's any similarities. And then we look at executive function. So I could talk about this forever. My dissertation was on executive functions, but just really quick, executive functions are kind of all of our higher level thinking skills, our problem solving, our organization. And they're housed in the prefrontal cortex, which is the front part of your brain here. Doesn't develop until you're about 25, right? But it's really impaired. There's usually hypo, not enough activation in the prefrontal cortex in ADHD. Um, an interesting sort of definition of executive functions that I just heard is how aligned your bodies are with your nervous system, right? So we can
Mm.
think of how when we see a kid with ADHD that's sort of out of whack. So we test for executive functions. We look at planning. We look at shifting attention. We look at cognitive flexibility, being able to think about one thing and then think about another thing and make that switch, which can look like in the classroom, like transitions and whatnot. There are a ton of executive functions. We could talk about it forever, but we definitely want to do some of that direct testing to see, how aligned is this kid's body with their brain. And then of course, we'll get parent input, teacher input. So ADHD is persistent, right? So that means the symptoms should be seen across settings. So we want to ask questions about what's going on in the community, at school, at home, with adults, with peers, right? So really seeing if there's just this sort of baseline inattention, hyperactivity, and or impulsivity that's impacting, this kid's functioning. So we look at lots of different things, but executive functions are a big one.
And I was going to say, as we talk about autism and ADHD, it's very frequent to see these comorbidly occurring with one another.
So occurring at the same time.
Mm-hmm.
Hmm. Yeah. Well, and I think, a challenge definitely with executive functioning, as far as at least like the time management and starting a task and finishing a task. I went to a training once for ADHD, and I've used this saying ever since I went there. They call it the pain of 1,000 paper cuts. And so it's like not just one big thing, but the challenges with executive functioning eh, create a lot of negative feedback from adults, of like, oh, why aren't you doing it now? I've told you a million times. It's not intentional. Parents are juggling a lot and doing their best, as our teachers, but when they're repeating themselves a million times, or tasks are half done, or there's stuff everywhere not cleaned up, it's understandably frustrating. So, you
And
know,
Emily, I think that's a great point in terms of like why, get an evaluation.
mhm.
Kids can be so easily misunderstood as lazy or unmotivated or a behavior problem, right? When there's really something else going on.
My concern in those situations when we have a kiddo with ADHD and it's not diagnosed or misdiagnosed is we often then see anxiety and depression coming in later on down the line as they're trying so hard to manage these ADHD symptoms, but no matter how hard they try, they're just not successful. So that always is a risk, and I've seen that happen so many times. And I think, kids are aware. I'll see kids as young as 5 years old that will tell me, I can't make my brain work. My brain isn't working right. I can't make my brain do what I want it to do.
Mhm. Yeah. Yeah, I think all great points. And like I said, if anyone has any additional questions to what we're saying, certainly throw it in that chat box. And if you do have to hop out at any point, this is recorded, so we'll make sure that everyone has that. Um, how about that gap with girls and ADHD? There are statistics around the ADHD diagnosis being missed more with girls, or the anxiety ADHD overlap. Would you have anything to say about that?
Yeah, definitely. So, females with ADHD tend to present with more internalizing issues. So it's not necessarily this sort of like bouncing all around, hyperactive, impulsive behavior, but it's this forgetfulness or disorganization or difficulty sustaining attention. Um, and from my experience, working with females, they tend to internalize their struggles more. Like Dr. Buckwalter was just saying, for girls, this can really lead to those symptoms of anxiety or depression. Um, Girls often tend to get diagnosed later. So they might have had a lot of what I talked about before, good compensatory strategies to kind of navigate around as best they could. Girls are more likely to mask symptoms. Girls are often associated, right, with being like quiet and socially adept, which can sort of lead to these problems with ADHD. And the hyperactivity piece too could be there and just be overlooked. It might look like excessive talking or fidgeting or emotional reactivity, and not necessarily that sort of running around, that we think of with typical boys with ADHD.
I think a lot of times parents come to learn about potential ADHD from the schools, and teachers have a lot on their plate, obviously, understandably. And so the boys, if they are more hyperactive, and absolutely the girls can be hyperactive as well, but it doesn't tend to look the same way as for the boys. So the boys are out of their seat, they're falling out of their chair onto the floor, they're chucking something across the classroom, distracting the child next to them. So that really gets the teacher's attention because it's very disruptive to the classroom. So I think those parents of boys will hear that feedback much more quickly than the parents of girls. And like Dr. Sav was saying, a lot of times for the girls, maybe it's, well, they completed their work, but they didn't turn it in because those organizational skills are really lacking. So that can look like something different than perhaps ADHD.
Yeah, so final pieces, as we look to learning disabilities, and then, the last piece will kind of be like, what are the next steps? You get an evaluation and then what? But in speaking of learning disabilities, which is super broad, obviously, that could be its own topic, but there are common, things that I think more common things that kind of come out in the learning disability category. But is there anything that you would clarify in terms of learning disability assessments?
So there's a lot of different ways to assess for learning disabilities. Sometimes we're looking at a discrepancy between IQ, cognitive potential, and measured academic skills, which is called a severe discrepancy. We're looking at patterns of strengths and weaknesses. In some cases, we're looking at response to intervention. I think so. There's different ways of diagnosing learning disabilities, and it's going to depend on the kid and what's going on. Something that I get a lot is confusion around this term dyslexia, right? Or parents saying to me, well, the school said they don't test for dyslexia, can you do that? And it's really all semantics. In the educational world, they use disability classifications of specific learning disability. And in the clinical world, we use, the DSM, specific learning disorder, which specifies dyslexia as a reading disability. So it's really just struggling with reading. I get a lot of sort of misconceptions about that. But learning disabilities are complicated. And like Dr. Buckwalter said, they're often comorbid. A lot of kids with ADHD, I think it's like 35% also have a learning disability. So there's a lot that goes into learning disability evaluations. But, if you do have concerns, it's definitely worth, seeing if something's going on, right? To avoid those labels, the unmotivated, the lazy, all of those things that we hear, to see if there's a difference in brain functioning and neural circuitry.
Hmm. Yeah, and I think there's like more awareness too now. Like I think growing up, I would just hear of dyslexia, and even more recently, I'm hearing a lot more about dyscalculia. Can you just explain a little bit about what dyscalculia is? Because I don't think a lot of people are versed in it.
Yeah, so dyscalculia is a math disability. So in the educational world, you can have a specific learning disability in math reasoning or math calculation, math problem solving, or math fluency. And then in the DSM, there's specific learning disorder with impairment in mathematics. And dyscalculia is really like an alternative term used to refer to a pattern of problems that have to do with number sense, learning math facts, and thought calculations. So to make it really simple, dyslexia, reading disability, most commonly diagnosed learning disability, dyscalculia, math disability.
Yeah, I just want to highlight that because I feel like there's so much awareness of dyslexia, but not as much with dyscalculia. So I don't know if that's different now, but so, wrapping up a little bit here. I know this is a lot of information to digest, so I don't want to like pile on too much. Um, is there anything that, but my final question will kind of be actually, all right, let me do that. Here's me jumping around. So let's do that question in terms of what should caregivers expect once they receive feedback or next step, or even an individual. So we've had, people of college age come in and say, hey, I've suspected this has been there. I'd like to get evaluated. So someone gets feedback, what happens from there?
I'll let you start.
So first of all, you should expect like a detailed review of the findings, right? So I love feedback sessions because we really get the chance to get into, how is this person's brain working and how can we use that information? So we'll talk about test results, strengths and challenges, and a diagnosis if applicable. Which is one thing that can sort of be missed in schools because schools cannot provide diagnoses. So getting that diagnostic clarity is something that we want to do. Um, We'll talk about individualized recommendations. So of course, there's research-based strategies that work for different disorders or subsets of, profiles and functioning, but we'll really talk about what are some concrete steps that you can take to sort of address whatever's going on. You'll get a written report, so you'll have all the information. The other thing that you'll get definitely from me, I'm sure from Dr. Buckwalter too, is a lot of emotional support, right? It's a lot to kind of process some of this stuff. And, it's our job to sort of provide the information in an unbiased and comprehensive way, and then hold space for you to sit with it, to ask questions. I always say once I'm on your team, I'm on your team forever. And I want to see, your kid, yourself, your family be successful. So there's a lot of collaboration that happens after, an assessment.
I would add on to that piece as well, and you certainly started to touch on this, but direction in going forward. So for a lot of the children with autism, we're going to want to look at, do we need ABA services, applied behavioral analysis? Do we want to look at the more traditional wraparound services that people are familiar with? So we can talk about the steps of how to go about getting those services, because you do need a particular type of insurance, and we can guide you as to how to get that insurance, to take that step to get the services. We can provide for you what's called a written order, so that way you can bring that to whatever appropriate agency and say, hey, I need ABA services. Hey, I need wraparound services.
Perfect. And I think that's so important to know too, that like it's not like you do this evaluation and you get the feedback and then you can never speak to that evaluator again. As a therapist, I've had people reach out to me to help them make sense of evaluations, and I'm happy to make sense of what I can, but it's good to know that like, and you should follow up with the assessing provider if you have more questions or there's something you're confused about, or are having trouble finding one of the recommendations. You're not alone, and that's the end goal, is to help people to not feel alone in this process, because it can be so isolating. Living with a disability can feel isolating already, for yourself, for your child, whatever it is. And so our goal is to really build up that support team. Dr. Buckwalter and Dr. Saviano, is there anything we did not touch on you think would be helpful? Can be any topic at all.
I think we touched on everything. I will say something that we'll also be able to offer is intellectual disability evaluations. So looking at adaptive functioning and cognitive functioning. But no, I think this was a really good summary of sort of the big neurodevelopmental disorders, and how we can help.
Yeah. Dr. Buckwalter,
I
any
agree. I feel like we could talk for so long because we just touched on the surface, but I would agree with that. And I know I started with this: trust your gut instinct as a mom. Moms know.
Yep. So a question did just come in. And so it says, my child has an ADHD or X. I don't know if you mean diagnosis. Um, yes. Okay. And the school just identified that they also have autism. Given that the school identified it, can the pediatrician give official diagnosis? Is that correct? In what? Yeah. Yes. Yes. Awesome. Thank you. Um,
I don't know that we necessarily would want to look to the pediatrician for that as
yeah.
the final diagnosis. I think you probably really want that from a mental health professional.
Yeah. And
I
I,
agree.
sorry, I'll let you guys.
No, I was just gonna say I agree. If you're looking for just to get something on paper, it would depend on your relationship with them, but you really want a comprehensive evaluation by someone who, specializes in autism.
Right, because my understanding with schools often, and I can be corrected, is that they may say like there's an indication of, and so I think one of the questions would be, and you can feel free to reach out to either of our supports here. I'm happy to, I'll put my number. I'm going to put my number in here right now so people have it and you can reach out. Um, but it's also, I don't know what the school used to assess that. So I don't know, if what assessment tools that they used would be helpful for whoever is then assessing to know. The other challenge I have run into is that I have met with youth before who have been given a diagnosis but not from a full report. So then when they go to get ABA service or something that needs the script, they are required to have the full report. And then they kind of have to go back to square A of getting a full evaluation because they need kind of the full tailored report that actually shows that versus just someone writing like, oh, autism is indicated type of thing. I know both of you talk about working with / evaluating younger kids. What about my kid who is 14? Are some places better fit for older kids than others?
I
I would feel, and I'm sure Dr. Savvy would feel as well, equally comfortable evaluating a 14-year-old.
Yeah.
And it's not uncommon. It's actually really surprising to me still, after years in the field, how often we'll see an older kid come in and somehow they never had the diagnosis.
I'm
So it's
doing
common.
Yeah, it's very common. I'm doing an autism evaluation right now for a 14-year-old. I'm doing an ADHD evaluation for a 20-year-old. So yeah, I think we both have a wealth of experience working with, that full age range.
Mhm.
And going back to that piece actually, because it's interesting. So, and I don't want to get too much in the weeds because I know we're time limited, but a very long time ago, we used to break autism up into a variety of different diagnoses. We don't do that anymore. We just talk about it as an umbrella, the autism spectrum umbrella. But under that prior categorization system, we talked about Asperger's disorder. And because Asperger's disorder, sometimes people will call it higher functioning autism, which I actually don't love. I think that's a misnomer because it can bring about its own set of difficulties. But because it doesn't bring some of the more stereotypical behaviors with it that people think of with autism, it's really common for kids to be missed with Asperger's type symptoms.
Yeah. Yeah. Well, I appreciate you both so much. Oh, wait, one more. And if someone has more questions too, I'm not rushing people along, but I missed the beginning, so I apologize. Oh, sorry. What are options for seeking an evaluation if money is an issue?
Well, I know our aim, right, Emily, is to be able to accept insurance, correct?
Yeah, I mean, insurance is something that we're navigating. We are not yet there. So for TLC Wellness, we do outpatient therapy, and then we have Dr. Sab and Dr. Bachwalder doing our evaluations. Our therapists, actually, I just got the news as of yesterday that our contracts have started going through for insurance. So we will be in network with Aetna, Blue Cross Blue Shields, Optum, Cigna, TRICARE, and we take a few EAPs as well. So those are the insurances for therapy. Right now, our psychology about our evaluations are out of network at this time. I am navigating what that would look like otherwise. I just always am careful when I talk about it because I don't want to make promises when I'm newly
Sure.
navigating that realm. And it is a realm to navigate. We actually started for our therapist that process in October. So that's why I was thrilled yesterday when I finally heard back that we were like in the final stages now and can begin to accept insurance. But I would say to at least, I can only speak for myself, but I would say to reach out. Sliding scale is an option. We don't want kids to not, or youth, adults, whoever, to not get services because of that. So we're always willing to have a conversation. And I would say many practices, if you see like it's an out of network, just still call because a lot of places do offer some level of sliding scale. It's important always to check what your out of network benefits are with your insurance, whether it's for therapy or an evaluation, because sometimes people are eligible to get a certain percentage back and they don't know that. Again, I'm happy to call and talk about that process and support in that process. And then you can always call your insurance company as well. There's a behavioral health number either on the back of the card or there's portals for pretty much all the main behavioral health companies. I would say all the main companies, and you can do a search there and find out who they have as listed in network doing evaluations. And I know there is one there. There's one or two like in the city and the suburbs that I can know of off the top of my head that take insurance. So there's options out there. So I would say just reach out, and I'm always happy to kind of point in a direction or think it through of like, hey, how can we make this happen?
And I don't want that parent or any other parent that might see this to feel hopeless that if you don't have the finances, your child can't get help. That absolutely is not the situation. And we can guide you as to other resources that might be
Yeah.
available. So thinking holistically, a lot of the community mental health providers are able to work with different insurances, Medicaid, Medicare, so they can help you out as well. And we can help you to get access to those services as well, to the Medicaid and Medicare, because a lot of times, and especially if you're looking at ABA services or the more traditional wraparound services, you will need the Medicaid in order to take advantage of that service. They do not accept private insurances. That's a state law. So that is something that we can guide you to. So there is hope no matter what the situation.
Yeah, we could go down a lot of different routes of options. So I would say to just give a call. I don't want to sound like a broken record when I say that, but every situation is unique, and every individual is unique, and everyone's in a different situation. And these aren't easy times for a lot of people. Things are expensive anymore, and I know in working with many adults, there have been a number of layoffs, and so it's just always worth a conversation. So I appreciate everyone's time showing up. This is amazing. I've done many events and live events, and sometimes even just had one person. So I appreciate every person that's come. I appreciate everyone that used the recording, and I appreciate Dr. Sav and Dr. Buckwalter for your passion and everything you do. And I have to say, like, there is nothing short of passion that I've seen between the two of you and what you're doing. So I just really appreciate you having a part of a TLC Wellness team.